Hello, everyone. Good evening, and welcome to the 15th episode of ICPA Clinical Series. The philosophy behind ICPA Clinical Series is solving one clinical challenge in each episode. And in the last 14 episodes, we have solved a variety of clinical challenges. And today we have something really exciting for you, for which we have Dr. Neeraj Rohida with us. He's an MDS orthodontist. He's the CEO of DN Rohida Technologies Private Limited, developer and owner of the digital dental software under the umbrella of DTS, including DTS Pro, DTS 3D, and other upcoming softwares in the dental domain. Dr. Neeraj is also a mentor to PhD students at IIT Bombay. He is an associate professor in orthodontics and a clinical researcher with research articles published in the American Journal of Orthodontics and World Journal of Orthodontics. He runs his exclusive orthodontic practice in Powai after completing his master's in orthodontics from the esteemed Government Dental College and Hospital, Mumbai in 2009. And I must mention here that Neeraj Rohida secured the first rank in MHCT entrance exam, and through which he got his MDS seat in orthodontics in Government Dental College and Hospital, Mumbai. So let me have the privilege of welcoming Dr. Neeraj Rohida here, and he has created a wonderful tool and a product which people can use, DTS Pro. And the main problem he solves through DTS Pro is we all face this problem of detailing the treatment plans to our patients. Sometimes patients understand, sometimes they don't. And more the complex the treatment plan is, the more difficult it becomes for them to imagine what the doctor is telling. So this critical challenge is solved by DTS Pro, designed by Dr. Neeraj Rohida. So the show is yours, Dr. Neeraj. Please continue.
Good evening, everyone. Thanks a lot, sir, for the absolutely kind introduction. And yeah, so welcome everyone to this ICPA clinical session. So the topic for today would be simulations and digital planning for the modern dentist. Now, most of us as dentists are running a sort of a dental business, right? So, marketing, ethical marketing, as we may call it, becomes an important aspect of running any business. So, does the same apply to dental marketing as well? So, we as dentists do a lot of efforts in having a lot of presence on social media, physical presence day in, day out. So, that becomes a part of the dental marketing process. At the same time, our basic clinical skills, we as dentists always keep on upgrading our skills by attending various courses and continuous practicing, improving our clinical day-to-day skills. What then remains in between getting the patients to the dental office and enhancing our clinical skills to the topmost level? The most important part then remains is how do we get the patients to say yes to our treatment, right? Now, to give you a simple, small story about myself, I, being an orthodontist, see a lot of patients with midline diastema. Back in 2012, when I had this continuous challenge of explaining patients different treatment options, when a patient walks into my dental office, I see a diastema, multiple a plethora of options comes into my mind. It could be veneers, it could be bonding, it could be orthodontics. Of course, I, being an orthodontist, would always be biased towards braces. Now, when I present patients multiple treatment options, a patient's the first question that comes in his or her mind is, Doc, can I see how this will look after I get braces done? Can I see how my teeth would look after I get bonding done? So on and so forth. Therein, I realized lies a very big domain, the domain of simulations, the domain of showing patients something on their own smile. So, typically, patients like these, we either show them different models showing them that this is how braces would look. We could either show them that, we could either do bonding for you and close that gap, or we could propose them something called as veneers. Now, how do we typically, in a routine scenario, explain patients such procedures? We would either show them before or after treatment pictures of our own patients, or we typically use similes. So, for example, while talking about a veneer, most of us would use a simile like veneer is nothing but like just how a contact lens sits on top of our iris. Similarly, a veneer sits on top of your tooth. Or, of course, we use a lot of educational models. One of the better ways of proposing treatment options to patients is either doing lab mock-ups or actually doing intraoral mock-ups. One of the closest and the most accurate methods of showing the patient different treatment options. The question is it really possible for us to do invasive steps like doing a mock-up or doing a lab mock-up for each and every patient who walks into the dental office? The simple answer is no. This leads us to a very, very important and a famous quote which says that a picture is worth 1,000 words when it comes to case acceptance in dentistry. Which means that showing the patients something on their own smiles brings about an absolute significant increase in decision making and eventually case acceptance. It brings this aspect of dentistry is also called as emotional dentistry. When the patients look at their own smile image, they get excited to go ahead with treatment, right? So this is the use of dental simulation softwares. Showing the patients something on their own smiles, presenting them different treatment options on their own smiles is what a typical dental simulation software does. Now, rather than talking to the patients about different treatment options, if I can show something to them on their own smile, explaining them how that diastema is going to get closed, don't you think the case acceptance and decision making becomes a cakewalk for the patients? The patients themselves then become a part of the decision making process. Hence, simulation softwares, I believe, are an integral part of any modern dental practice. These days, this is a selfie age, right? Everybody has a camera in the pockets. Everybody has a selfie, a collection of selfies where they examine their smile from each angle, from various different angles. In this age, showing patients something on their own smile becomes even more mandatory, right? Now, of the different simulation softwares which are already available, the basic criteria is any simulation software has to be simple and user friendly. We are primarily dentists. We do not want to spend hours and hours on a very technical software that is going to give us excellent simulation results, but that is going to eat away half of our clinical time. So the idea was to develop a software which is very user friendly, simple, and of course, as with anything in life, value for money, right? With that was born the idea of DTS Pro. Now, the same patient can be presented different treatment options. For example, on the bottom left, I have presented the patient an additive option. Now, that could be composite bonding, that could be veneers, but making the patient understand of how she would look after something has been added onto her teeth versus how would she look after those spaces or those gaps have been closed by moving teeth. In this scenario, case decision making becomes a very easy aspect for the patients and eventually leading to greater case acceptance. Presenting to you some of the cases which have been planned and eventually executed using DTS Pro program. And of course, I'll be doing a very small demonstration of the workflow that involves the DTS Pro software. So this was a patient presenting with aesthetic needs. The top is the simulation that was presented to the patient for veneers. DTS Pro allows us to have a video loop so that the patients can see in real time the changes that are going to be happening on their teeth. Once the patient accepted this treatment, so the top is the simulation and the bottom is the final result, right? Case number 2. Now, in dentistry, most of the cases either are additive, when we add something onto the tooth surface, or subtractive, that is, we reduce something from the tooth surface. Now, in this example, as you see on top, this patient needs some amount of crown lengthening. Now, for any reductive cases, any subtractive cases, simulations are the only way in which you can generate digital simulations are the only way in which you can showcase patients the proposed post-treatment results. For additive cases, of course, we have lab mockups, chair-side mockups, and other options. But for most reductive cases, irreversible procedures, things like crown lengthening, things like crowding correction, simulations is the easiest and the quickest way of proposing the desired changes. So as we can see on the top, that's the simulation for crown lengthening, and the bottom is the post-op result after the crown lengthening and veneers have been carried out, right? Again, a simple enameloplasty done for this patient for the two central incisors. The reductive case, subtractive case takes me less than 30 seconds to carry out the simulation, present the treatment plans to the patients, and get the patient's approval before going ahead with any treatment. So again, when we have a simulation software, it has to help us create simulations for simple clinical situations. Say a simple enamel wear, a little bit of enamel chip, a class 1 fracture. Because not every patient who walks into the dental office will be a full mouth case. Not every patient would need 10 veneers or 20 veneers, right? So simulation software should also help you do simple simulations like a little crown lengthening, correction of gingival zenith, say a whitening procedure. These are features which should be present in any basic simulation software. A patient with crowding. Now I'm just taking you through different simulations that have been carried out using the DTS Pro software. And of course, I'll be doing a case so that you understand how the entire workflow is carried out. Again, patient with orthodontics, reductive case, subtractive case, there is no way to show the patient's proposed post-treatment results. And in the modern era, more and more patients are getting aware of, there are a lot of multinational companies in dentistry who are showing patients, who are telling patients that we will show you, we will give you an idea of how the post-treatment results are going to look like. So many patients, particularly with cosmetic needs, they want to first see how the proposed treatment plan would be before undergoing any procedure. I always use this anecdote that when we give our house for, say, an interior designer, the first thing that the interior designer gives us is a 3D mock-up, that this is how your house is going to look like. So for a patient who is going to get some transformation in the smile, don't you think the patient would be too keen on first understanding what the proposed post-treatment results would be before entering into any sort of, I would say, irreversible decision, right? This is where simulation softwares come in really handy. Not only dental mock-ups, a lot of patients undergoing surgical treatments would also like to understand the proposed changes on their smile. So again, class 3 mockup designed with DTS Pro. Not only that, lip fallback after orthodontic treatment can again be easily proposed using the DTS Pro program. And just to take you through the different simulations that are possible. So basically, a software should be able to allow you clinical simulations for the most complex cases, multiple veneer cases, treatment planning. I will come to part 2 of treatment planning. So any simulation software for that matter, I would broadly classify under 2 categories. First category is patient motivation and patient simulation. The second use of a simulation software is treatment planning. So what you have shown to the patient, what you have proposed to the patient, how do you plan the treatment, how do you communicate with the lab, and how do you eventually give the patients something in 3D, something in real that you have shown the patients to 2D. So this is how the workflow is First, simulation, treatment plan, communicate with the lab, do the 3D designing, deliver to the patient, right? Again, a simple tool in DTS Pro called as Instant Smiles takes us less than 30 seconds to propose the treatment. Now, this is an elderly patient needing a denture or a full mouth rehabilitation. Who says aesthetics is not important for an 80-year-old? We make assumptions, but even to an 80-year-old, to a 70-year-old, when we give them multiple treatment options, it does help them in decision making. Aesthetics is important for everyone, and everybody would need to be a part of the would like to be a part of the decision making process at any age, right? Just presenting to you a case done by one of my dear colleagues, Dr. Amit Gulati. So, case of midline diastema. That was the extraoral picture proposal using DTS Pro software. Patient got ready for treatment. That's the intraoral planning using 8 veneers. The entire treatment plan was carried out using simple photographs, retracted photographs, measurements done and sent to the lab. Now, once these treatment plans are sent to the lab, there could be two ways for the lab to convert the treatment plan into actual 3D results. One is lab analog, where these measurements will be actually used by the technician to do the wax up on a model, a physical model, that is called as the analog method, versus using a 3D software to design. I will give you a glimpse of how that designing is done. That is called as a digital method, right? So these treatment plans that is sent by the dentist to the lab helps in lab communication. So the lab has use these measurements to do the wax up. The wax up, once it is transferred in the patient's mouth using the normal putty index, that is the test drive for the patient. So the patient is taken approval at 2 steps. The first step is the digital simulation, so which takes us less than a minute to actually show the patients the proposed treatment plan, get them excited for treatment, get them motivated for treatment. As I would say, I would broadly categorize patients into group A, group B, group C. Group A are patients who have come to us with a particular need. Say, for example, doc, I want to get my gaps closed. So you do not need to get them motivated for treatment. They already know that there is a problem in their smile and they need to get them corrected. So in such patients, DTS Pro can help you generate different treatment options. Say, for example, veneers, it could be bonding, it could be orthodontics. Group B patients are patients who are sitting on fence. So they know that there is something wrong with their smile, right? But they are not yet ready to take the jump for whatever reasons. Such patients, using simple simulation softwares, less than 1 minute of your time, can actually be easily converted into group A patients where they are motivated for treatment. Group C patients are patients who know that there is something wrong with their smile but consider it as a lucky charm, right? For example, there is a patient who would have a high placed canine. I told her, ma'am, you've got this high placed canine and it should be taken down with orthodontics. She said, doc, that's my lucky charm. I get a lot of money because of that canine. Now, in such patients, they are absolutely not motivated for treatment, and no amount of patient convincing or wasting my time is going to get converted to group E and group A, right? So once you have shown simulation to the patient, you can actually go ahead with second approval, that is a test drive. Using the same measurements, the test drive, the clinical procedures. I'm not going to talk about the clinical procedures here or the principles. I'm just going to throw light upon the 2D to 3D workflow, mainly of DTS Pro software. So just to finish off this case, the crown lengthening was carried out using the measurements done in the software, and that is how the post-op results were. Right? One more quick case of showing how a 2D workflow treatment planning. So I've shown you the patient motivation part. I'm just very quickly taking you to the treatment planning part. Again, that was a simulation done for the patient on top, on the retracted photographs as well as extraoral photographs. That's the treatment planning which was done, sent to the lab. And that is how the post-op results eventually panned out to be, right? So a pre-op situation, simulation done using DTS Pro software, and post-op, right? So simulations and treatment planning, these are two critical aspects of any planning software. It depends upon the dentist to what extent do they want to use any digital planning tools. Some would say use it just for the motivational aspect, simulation aspect, and stop there, not necessarily go ahead with the treatment planning part, right? So to conclude, any simulation software is a very, very, very important communication tool between the dentist, patient, and the dental lab, right? Showing patients something on their own smiles, the software should allow you freedom to do clinical simulations for any condition, not limited to full mouth. It could be a simple enamel chip, it could be a full mouth rehabilitation, it could be orthodontics, it could be bonding, it could be simple whitening. With that, I would just like to go ahead and do a very quick planning to show you how exactly does the DTS Pro or any simulation software for that matter work, to show you a simple clinical situation. Now, once a patient has walked into the dental office, all we do is take a simple extraoral picture. Now, you could either use the DSLR camera or you could use any mode of getting a picture as long as it doesn't pixelate, because a simulation has to be a decent presentation. If the simulation is not good, you yourself, the case acceptance, I mean, what I want to emphasize here is it doesn't matter your photograph has to be the best photograph in the world, but it has to be a presentable photograph when you present any sort of simulations to the patient. So that's the photograph that I have taken for the patient. I have done some basic steps. Now, the DTS Pro software has got some automation built into it using the artificial intelligence technology. So all these landmarks are automatically marked by the software. The smile area, the interpupillary line, the midline is automatically detected by the software. Now, I can use something called as instant smiles, which gives me an immediate simulation based on the patient's existing condition. Of course, I can adjust my templates and get the best possible fit. This is something that we called as instant smiles. So choosing from one of the best available templates that is built into the software, or you can add your own templates as well. Again, to emphasize a point here, I am just going to show you how the functionality of the software. It is beyond the scope of this presentation to explain each and every step, but to just to give you a gist of why simulations and why digital treatment planning is almost a must in the modern dental practice. So once I have done a simulation, I can do a few minor adjustments. And before I have taken a patient's picture, before the patient is in the dental chair, I have my simulation ready. This gets the patient motivated and excited for treatment. The questions then start at the end of the patient. Doc, how do I reach here? What are the different ways for me to go from my gap or to go from my present smile condition to the proposed smile condition? That is where decision making part comes into picture. Again, I will show you how using the software I will be able to give this patient multiple treatment options. Right? So now, simple situations, just to demonstrate you a simple tool for whitening. Many patients come to us for bleaching, wanting to know, doc, how much can you whiten my teeth? I just need a simple picture. If I am doing, say, 3 shades of whitening, I would appropriately increase the whiteness. 4 shades of whitening, I would appropriately increase the whiteness and give the patient a very rough before after, that this is where we are going to start and this is the proposed end result, right? As we say, every simulation has a disclaimer which says that it is a simulation. It's a roadmap, right? To get the patients understand the proposed treatment changes. Now, similarly here, this particular patient's decision making would be either additive dentistry or orthodontics. I can just use my simple tools of giving the patients. Now, if I tell the patients that you're going to need braces, which will take you say around one year, the first reaction of any patient is, doc, no, I am not ready for such a long treatment process. Okay, so this is what I can give you if you're not ready for braces. I can definitely treat you without braces, but this is what you're going to get. The patient's reaction is, doc, you know what? The gap is closed, but my teeth look too broad. They look too wide. I don't really like them. That's what. I go back, I give the patient a second treatment option that, you know what? I can close your spaces by moving teeth rather than by adding anything to the tooth material. Of course, I can use my tools to get a better finish simulation, but just to give an idea. And this can happen while I am talking to the patient. I can talk to them through, small aspects of cosmetic dentistry, of correcting incisal shapes, correcting crown positions, getting teeth whitened a bit, so on and so forth, as I'm talking to the patient on the dental chair. So I give them a second treatment option that this is where I could take you possibly once I move those teeth using braces. In such scenarios, it becomes crystal clear for the patient to understand the effect of additive dentistry, orthodontic treatment, bonding, for example, veneers, whitening, different treatment options on their own smile. For as for a dentist, it is easy to understand jargons like braces, like veneers, like bonding. For a patient, for a lay person, it is really difficult to understand the effect of these treatment results unless they are shown something on their own smile. If you recollect in the presentation which I just showed you, there was hardly any text which I had used. It was only pictures. Pictures are self explanatory. Pictures really speak more than 1,000 words. That is why simple tools like simulation softwares, intraoral cameras, telling the patient is one thing, showing the patient is an absolute different ball game altogether. Right? Not only that, now this patient is getting convinced for braces. So, what type of braces can you help me choose? Yes, ma'am. I can help you choose with different type of braces. Of course, I can just edit them, but just to give you an idea, this is how metal braces would be. This is how ceramic braces would be. This is how self-ligating braces would be. So, again, showing the patient something and telling them something is an absolute different ball game altogether. This is how the idea of DTS Pro was born. This is how we started as a small software package with a couple of features, and with feedbacks, with detailed development, we go on from DTS Pro to eventually DTS 3D. I will just give a very quick idea of what do we exactly do with the treatment plans that we have designed in the software. So I have designed, say, a 2D treatment plan as I showed you in the software. Once I send it to the lab, either the lab will use it to do an analog wax up, that is a manual wax up, or they will use in certain softwares to do a 3D wax up. So the 2D designing which I have done for the patient, I can then go a step ahead. Now, to re-emphasize this is the last concluding part of the presentation. So the software was used for the initial motivational part, to the digital treatment planning part, as you can see on your screen. And eventually what happens to the 2D plan is now we are designing in 3D so that we can actually print something and show it to the patients in their own mouth. That will be a digital mock-up. So you create a simulation, that's the digital mock-up, and you print it and place it inside the patient's mouth using a putty index. That's a 3D mock-up or a 3D simulation. So just to give you just a gist of how the 3D software is used is, I have used the patient's scan. I have used my designs that I have done. So these are my designs that I have planned in my DTS Pro. I have put them in DTS 3D, and those are my new teeth which I am going to add onto the patient's existing teeth, do a 3D printed mock-up, print that, transfer it to the patient's mouth. And that is how I have this new model. So I've shown the patient a 2D simulation. I've shown the patient an immediate treatment plan. I've shown the patient that this is what the proposed treatment result would be. Step one, which takes me less than 30 seconds, which takes me less than a minute. I maybe go ahead and do a 2D treatment plan, which takes me roughly around 5 minutes. I transfer it either to the lab, let the lab do the job for me, or do it myself using the DTS 3D program or any other 3D software. Do the actual wax up, print the model, send it for printing, and use it for intraoral mockup. So that is where digital dentistry is headed to, from 2D treatment planning to 3D designing. Digital dentistry is opening a lot of domains for us dentists. It is making life much simpler. It is getting us into a lot of avenues which were till now thought to be beyond the reach of a dentist. For example, digital wax up. Who would imagine that you can do digital wax ups in your own practice with a few clicks? With the advent of 3D printers, with the advent of intraoral scans, it is high time that we embrace digital dentistry. Just like any field in dentistry, even digital dentistry has a little bit of a learning curve. Now, when I'm talking about simple simulation softwares, they do not have much of a learning curve. So the first step of getting into digital dentistry, to get a decent patient's photograph, show them simulations, get them accept treatment, help them decision making, and eventually get into better, more predictable end results. So I hope I have been able to put the message across that digital dentistry is no rocket science. We are proud that we are the first Indian company uh, of, I would say, entering into the digital space. And what started as a small one-man show, we are still small. I'm proud to say we have more than 5,000 dentists all across the globe using the DTS Pro AI software. And the reviews that we get is it takes them less than a minute to get case acceptance into practice. So I believe I have been able to put my message across. Let's embrace digital dentistry. Let's embrace simulation tools. Show patients what are they getting into, and that will really help us get case acceptance to the next level. I hope I have been able to put my message clear across to most of you. Thank you for attending the presentation. That is all at my end. I hand over the forum to Dr. Rajiv, and we will take it up from there.
Thank you, Neeraj. It was a wonderful presentation, and you have solved a very big problem. Very commonly, we see that the clinicians, the dentists are trying to explain to the patients, and most often they try to explain the treatment sequence. This is what we do with this tooth, this is what we do with this tooth. Even with the entire treatment sequencing, the patient is still not able to visualize how he is going to look once the treatment is over. So we need to move over from treatment sequencing to treatment planning, where you are able to show them the end result, and patient is able to visualize in the beginning only, so he knows where this treatment will take him to, and that makes it very very easy for the patient to accept your treatment plan and say yes, and it saves a lot of headache and time of both dentist and the patient. And I must congratulate you for coming up with this great innovation. And we have a great compliment here from none other than Dr. Deepil Mehta, one of the most well-known and renowned smile designers in India. He says DTS Pro is the most clinically oriented, easy to use, effective, and well-priced software. And proudly, Indians have been an extremely happy users, and it has helped me in my patient communication and has helped me increase patient conversions big time. So ultimately, it's all about effective communication and helping the patients understand and say yes to treatment plan. So it's a big conversion tool, and I'm sure a lot of dentists who have seen this have realized how easily they can convert their patients by showing the simulation. So let us take some of the questions that our viewers have sent. Most of the questions related to the cost, which we talk about in the end. And somebody asked, can we use this for aligners?
So, when you say aligners, again, as we just discussed, any patients who's needing, say, an
Okay,
orthodontic treatment or cosmetic dentistry would like to see the end results. So, yes, you can definitely use to simulate the end results, but not specifically for designing aligners or for orthodontic designing software. It's not an orthodontic designing software, it is more of a simulation software. So, definitely, yes, you can use it for the
great,
aligner
great.
cases.
I think you have already answered this. Can a 3D model be printed to along with planning the design?
So that is a separate software. That's the DTS 3D software. So yes, definitely that can be used to print the model. Once you have the scans, you can use the 2D planning, superimpose it on the scan, and do a 3D mock-up for designing.
Great.
That is not yet available. Just for the information, it's not yet released. The DTS 3D software, but we're looking forward to the release soon.
Okay. Next question is, with so many softwares for patient treatment simulation available in the market, what are the criteria on how to choose which software is best for my practice?
So I just covered a slide on the same, which I emphasize on the point that any there are, you can do simulations using Photoshop, you can do simulations using PowerPoint, you can do simulations using any basic photo editing software. The idea is the software has to be simple to use. As I say, we are not, maybe digitally, not everybody is a digital expert, right? So it has to be a very simple to use tool. Very important criteria why I always emphasize point number 2 is it should be able to help you create simple simulations. Now, for example, sometimes not every patient would need 10 veneers, 20 veneers, or a full mouth rehabilitation, right? Sometimes there might be a patient with a little bit of gingival zenith mismatch. We as dentists know that correcting that little gingival level is going to bring about a significant change in the smile harmony. How do we show this to the patient? Just take a simple picture, use a tool. It will take you less than 1 minute to show the patient the simulation. So the software should be able to allow you simplest of changes, say an incisal fracture, a little gingival zenith mismatch, to the most complex full mouth rehabilitation cases. And of course, as everything in for everything in life, cost does matter. So we definitely try to be as cost effective as possible.
Great, great. Can we do simulation on patient's photo? Yes, this you have answered, and you have also explained the kind of photos the photo should not have any pixelation. This is what
Yeah,
you said.
yeah.
Okay. Then, okay, what should we look for when deciding the lab which can emulate the simulation that we are showing to the patient? Any recommended labs or any criteria based on which we have to decide the lab?
Right. So as far as labs are concerned, most labs are moving on the digital platform. Slowly but surely, most of them are coming over from getting the analog wax up, where each and every tooth is manually carved, each and every crown is manually carved, to a digital platform where everything is getting digitally 3D printed and milled, right? So any simple lab which has a CAD cam, for that matter, any technician who understands the dentist communication, I would say, can understand these 2D plannings, because it is all about measurements. So even if somebody, a technician is doing a hand wax up, if he knows that the gingival level is to be raised by 2 millimeters, for example, or the incisal edge is to be lowered by 1 millimeter, once the measurements are communicated to the lab, either they could replicate it using hand, that is what we said is the analog method, or they could do it on a 3D software, which is what is called as the digital method. So most dental labs should be able to use the 2D designs designed by the dentist.
Great. Somebody wants to know how you have incorporated it, how fast and commonly you have incorporated this in digital orthodontics that you practice, because you are an exclusive ortho practitioner.
So, as I just mentioned, the entire idea of DTS Pro was born, um, particularly after seeing a lot of patients with diastema who wanted to understand different treatment simulations on their smile. So, I practically use it for all of my patients, whether they are in cosmetic need or no. All I need is a single photograph to actually put it in their mind that this is where their smile could be. Not everybody would be coming to me with the aim of getting cosmetic dentistry done, but a simple photographs is all it takes me to convince the patient, most of the times from group B to a group A category.
Great. We also have a prosthodontist here, Dr. B. Srinivasan. You are senior in GDC. He's a maxillofacial prosthodontist doing great work in in the rehabilitation of cancer patients. He's working in Pune. And he says, congratulations, India is now beginning its own innovations. His question is, can an increase in vertical dimension be simulated?
So, once a simple answer to this is anything that can be changed on a photograph can be simulated using the DTS Pro program. So, if you, for example, want to lengthen on a profile picture the jaw, definitely you can do it.
Okay, okay. And there is a question, how to choose what I should buy, DTS Pro or DTS 3D?
Oh, as I just told you, DTS Pro is what is commercially available at this point of time. I just
Huh.
went ahead and showed the DTS 3D program to just give an idea of how the 2D to 3D workflow would be. It is under beta test yet, so should be available soon.
Okay, okay, great. And now coming to the most important question, how they should contact you and what is the price?
Oh, I think I will just want to enter the website name of the software, that is dentaltreatmentsimulation.com. I will just mention it there, and all the information, the commercial information is available on the website, and definitely we have our technical team who can be contacted through the website itself.
What we'll do is, after 2 days, today we are on Wednesday, Friday, we'll be sending a 5 point summary of this lecture with the link to the recorded lecture. And in that summary, we will mention the website name as well. So it is
Sure,
dentaltreatmentsimulation.com
that's right. Yeah,
is the full form
that's
of
under the name
DTS.
DTS, that stands for dental
Yeah,
treatment simulation.
dentaltreatmentsimulation.com, very easy to remember. Okay. And any online purchase, how what is the process if somebody wants to buy? They
So
can
you can
directly
just go
purchase
to
on
the
the website.
website. There are
Everything is there on
details
the
there.
website.
You can directly purchase it on the website and download it instantly.
Okay, okay, okay. A few more questions have come. I have a tabletop scanner. I don't know what they mean by that.
Yeah, so I mean, when they talk of desktop scanner, so yeah, definitely for DTS Pro, for the simulation planning software, it is more to do with the images. You can also import STL files, so that STL files could come either from an intraoral scan or from a desktop scanner. You can use it for
Okay,
treatment planning for sure. So the input is the STL file. The source could be the desktop scanner or it could be the intraoral scanner.
great. Next one is this compatible with mobile phones? Can we run this on our mobile phone?
This is a Windows based software, so it can be used on a Windows desktop or a laptop.
Okay. So in the future, it may become mobile friendly, but as of now, it is to be used on the
It is a
desktop
desktop.
using
Yeah,
Windows
yeah,
software.
yeah.
Okay. I think that answers almost all the questions that have come. I don't think any live question, no, any question from the live participants left. So thank you, Dr. Neeraj. Thank you for this wonderful presentation, and I congratulate you once again for coming up with this mind-blowing innovation. And I wish you all the success. And for people who had registered but missed watching this session, we'll be sending you the summary of this lecture and with the link to the recorded lecture. And of course, the 5 point summary will also contain the URL through which you can go to the website and get to know more about the software. And if you want, you can directly purchase from there. So thank you so much. And thanks to all the viewers for joining in. And that brings the episode 15th of ICPA Clinical Series to a successful conclusion. And we'll be having our 16th episode in the month of July. We'll be having two episodes, and you'll be hearing from us on the social media, different social media platforms. So again, we'll be coming up with different clinically relevant topics, because ICPA Clinical Series is all about each episode, one clinical challenge. So thank you so much. Thank you, Neeraj. Thank you once again. Thank you to all the viewers. Good night and take care.
Thank you, everyone. Thank you, sir, for having me on the show, and all the best. And may Indian dentistry conquer great heights. Thank you.
Great, great.